There is an interest in using vitamin D to protect against coronavirus. People have been investigating the use of vitamin D to protect against acute respiratory infections since the 1930s when cod liver oil was investigated as a means to protect against the common cold. There is an overlap between the risk factors for severe COVID-19 and vitamin D deficiency, including obesity, older age, black and ethnic origin. In August 2020, The Lancet published an article indicating that there is good reason to suggest that vitamin D helps host responses to protect against coronavirus. The Lancet indicates that one study shows that vitamin D can modulate overactivation of the renin-angiotensin system. This system appears to be important in the context of severe COVID-19. The authors of the Lancet article indicated that they have shown that respiratory diseases cause a problem with vitamin D regulation, so that low vitamin D levels might occur as a result of pulmonary inflammation. There is also an article out of the Mayo Clinic in October 2020 which indicates that there is not enough information to recommend the use of vitamin D to prevent COVID-19. However, they do indicate that studies have shown that patients with vitamin D deficiency are more likely to test positive for coronavirus than those with normal levels. They also point to studies which show high rates of vitamin D deficiency in patients with COVID-19 who experience acute respiratory failure. Finally, they indicate that a small randomized study of 50 people hospitalized with COVID-19 show that fewer of those patients receiving high doses of vitamin D required treatment in the intensive care unit. The authors of the Lancet article argue that until there is definitive evidence for the ability of vitamin D to protect against COVID-19, it would be reasonable to suggest a daily vitamin D intake of 400 to 800 international units per day, especially since it helps promote muscle and bone health.